Thank you.
I believe Assemblymember Stone, who graciously allowed Assemblymember Bonilla to go first. We'll let you're next. And then quite the gentleman.
And a scholar.
And a scholar.
And a bow tie.
And then I saw, I think, Assemblymember Gatto? Yeah, he'll be after Assemblymember Stone. Good afternoon.
Thank you, Mr. Chair. Senators, I'm here to present AB 848 for you to solve a problem with residential treatment facilities that are licensed by the state of California, and the fact that they cannot provide incidental medical treatments at their facilities under their license. All that this bill does is allow them to seek with the state to be licensed to provide incidental medical treatments at their facility, as well as the other treatments, that drug and alcohol treatments that they normally provide. So this does set up the ability to request that sort of license subcategory, if you will, and this sets a procedure around it. That's what the bill does, and I respectfully request your support.
Thank you. Anyone like to speak in support?
And members of the committee, my name is Rod Libby. I'm Executive Director of Janus of Santa Cruz. We've been providing substance abuse treatment in Santa Cruz County for about 35 years. Quite in very simple terms, what happens when someone comes into treatment for a substance use disorder is we do a fairly thorough assessment. And these are pretty sick people. They've had very deep and long-term addictions before they come in. They often have additional related medical problems as well when they come in that complicate their need for medical services while they're in treatment, often mental health conditions as well. Very common that people are diabetic, have heart conditions as well when they come in. Under current practice, we're asked to use something called ASAM criteria, which are criteria developed by the American Society of Addiction Medicine, which tell us which level of care the person should be in. About 85% of the people presenting for care need to be in a level called medically managed detox as they come into treatment. Current regulations do not allow us to provide any medical services in that program. So the paradox is we've got evidence-based practice telling us this is the level of care the individual needs to be in, and it's a medically managed level of care, but the regulations say we can't provide that. AB 848 addresses that problem completely. Thank you.
Thank you. Anyone else?
Hi, thank you for allowing us to speak today. I'm Dr. Angela Barr. I'm an addiction specialist, fellow trained and board certified in addiction medicine. I am here supporting the California Society of Addiction Medicine. Quite simply, on-site medical care by a licensed physician at a residential facility would provide immediate assessment and stabilization to eliminate the disruption in treatment when a residential facility client has medical needs during the course of residential treatment. The facility staff must send him to a doctor's office or hospital emergency department. This is not only inefficient and costly, it can sometimes be dangerous. AB 848 takes a positive step in lifting the ban by updating the law to allow residential treatment facilities to provide limited medical services under state supervision. I urge your aye vote to the bill to allow medical care by physicians to persons undergoing withdrawal in residential facilities. We ask this of you because we know that this medical care is an integral part of successful treatment, and lives will be saved as a result. Thank you.
Thank you. Anyone else?
Thank you, Mr. Chair and members. Tom Renfrey with the County Behavioral Health Directors Association of California. Just real brief, given the current epidemic of opioid abuse, counties need more treatment services for substance use disorder treatment, including residential programs. This good bill will enable these programs to provide better care for a medically fragile population, and we do support and encourage your support. Thank you.
Mr. Chair, members, Steve Carlson for Promises Treatment Centers, co-sponsor of the bill. One of the ironies of this is that the residential treatment often, because you can't get licensed to provide simple medical care like taking blood or taking blood pressure, you have to put a client into a car and take that client somewhere else. which makes no sense. It's actually not environmentally healthy. It's not good for the client. This is a simple bill that we've been working on for 3 or 4 years now, and we hope that this finally is the one that gets us across the finish line. So we urge your vote.
Thank you. Anyone else in support? Opposition? Questions? Yes, Senator Nielsen.
Thank you, Mr. Chairman. I'd like to pipe in on the bill. Didn't get into the front part of this bill, but I'm familiar with the issue extensively, and I want to endorse it. You know, I never miss an opportunity to bring up AB 109, and this is an example. 109 was passed with the premise that treatment's better done in the community. Well, I don't disagree with that, but we have not enhanced treatment opportunities in the community post 109 or before. This is an opportunity for a population that is out there in vast new numbers that have great needs that would respond to some of this care that they would get here, and some of it, I don't know if it's called incidental or whatever, but that class of individuals don't just have alcoholism problems. There are other health issues that are extant, and they might get taken care of. So I think this is a very good idea.
Anyone else like to?
I'd like to move the bill.
Yes.
We have a motion by Senator Manning. Would you like to close?
I ask for your aye vote.
Chair is recommending support. This is AB 848, due pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning.
Aye.
Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Currently has 6, enough to get out, but we have members absent, so we'll place that bill on call.
Thank you.
Thank you. We're in item
Senators.
number 3, AB 170, Gatto. Newborn screening, genetic diseases, blood sample collected. Good afternoon, Assembly Member.
Good afternoon, Mr. Chairman and members. I want everybody to, for a minute, just imagine that you go down the street and get a cholesterol test. You're doing something that's very good. You're going to screen yourself for something that can be very harmful. So you go and get your cholesterol test, and what is your expectation? Well, you hope that they're going to test you for high cholesterol, and of course they're going to destroy the little sample you give them as medical waste. Well, that's not what we do with our newborns. We screen them for diseases. It's a great program. Last year I worked with Dr. Pan to expand this program to adenoleukodystrophy, which I never pronounced correctly. But Newsweek then did a story, and they came out with a story that indicated in the state of California, unlike most of the other states, unlike 47 of the other states in the union, the state of California then takes that sample of blood and they store it forever. So imagine you taking a cholesterol test and the government taking your blood and storing it forever. But it gets even better. The government then leases your blood to for-profit researchers to do tests without your consent, without your knowledge. This is what we are doing to our newborns in the state of California. So Newsweek did this story, and then when the Orange County Register found out about it, the San Diego Union Tribune, Sacramento Bee, and the Los Angeles Times, they expressed I think what most people feel out there, which is mortification. They could not believe that the government has a DNA bank of every child born in the state of California going back the last 30 years. Obviously, this raises privacy concerns. What happens if this blood gets in the wrong hands? What happens if the genetic material gets in the wrong hands? What happens if 10 years from now there's a technology that we cannot even imagine that does something detrimental to these samples? What if a researcher left their laptop on the subway and someone was able to screen this sample for the certain genes that indicate a propensity for alcoholism? The potential for discrimination and mischief when you're talking about the very stuff of life is profound. We are a state that prides ourselves in giving something like good information to parents. We want to label things. We want to make sure that people can make a decision that is accurate and that is informed. So what this bill would do, and it's been watered down a great deal since it passed Assembly Health, is it would simply provide a form to parents when they're going through this very emotional time of childbirth, and it would tell them, it would let them know, you know, hey, this is what happens, this is why. It would be worded in very simple English. It would let them know that why we do this and their options and how they can write for some more information, and then it would require them to sign to indicate that they were aware that they had been presented with this information. I think that's the least we can do for parents in the state of California. If the state of California is going to keep the blood of every child born for 30 years, I'm sorry, for indefinitely, I think we should let parents know, and I would ask for your aye vote.
Okay, anyone like to speak in support of the measure? Any opposition to the measure?
Good afternoon, Mr. Chair and members. Tanya Robinson Taylor here on behalf of the California Hospital Association in opposition to AB 170. CHA agrees that parents should receive detailed information regarding California's newborn screening program. Under existing law and practices, hospitals currently do provide information twice, once during a prenatal visit and again upon admission at delivery. AB 170 includes duplicative requirements related to providing this detailed and important information to parents for approximately 520,000 California births annually. California's newborn screening program is heralded as a model and has been operating for several decades without recorded instances of privacy or security issues. CHA believes this bill is unnecessary and agrees with the Senate Health Committee analysis that the need for this bill is unclear. Additionally, there is a federal process underway that is examining informed consent for the use of blood spots for research. CHA believes California should wait until that federal process is complete before making any changes to the program. For these reasons, I urge your no vote.
Thank you. Anyone else would like to speak in opposition? Thank you. Any questions, comments from any of the members? Senator Pan.
Oh, thank you. So something regarding, I guess the first question I have is that, so you mentioned they keep the spots. Do they tie the sample to identifiable information about the child, or is it simply they're keeping different samples of blood spots? In other words, can be traced back to a particular person, or they're de-identified? My understanding is that they've been de-identified. But
that is incorrect. So they do, there is a database in California that lists the baby's name and links it up to the serial number that's on the blood spot. So my wife just wrote in last month and said, you know, my daughter's name is blah, blah, blah. Please destroy her blood sample. And they obviously have to go into the vault and find my daughter's blood sample and then destroy it. So there is a database in California that links the names of every child born with that blood sample.
And
with a serial number.
Right.
There's a name and a serial number.
Okay. And I guess the other question I have is because what this bill says is that you can't use the blood spots de-identified or identified, but I mean, for example, there are developments of new technologies for newborn screening. So, for example, actually, one at UC Davis, they were looking at blood gas chromatography. There's some other techniques, and in some ways, they don't need to know who the person is, but what they're doing is they are doing research to develop better, improved technologies that may have better detection or something for newborn screen, or being able to screen for additional conditions as well. And because they're rare, you need a large volume, right? So it's hard to go to a million people, but if you have previous samples, you could run that without actually knowing who the people are. What you're doing is you're trying to figure out, does the rate that you're picking up equate to the rate that we diagnose, you know, epidemiologic-wise? Would that kind of research be forbidden by this bill? No, this bill just requires a piece of paper to be given to parents that says, the exact wording is actually in the bill. It just says, newborn screening can save your baby's life. There's a paragraph on that. Then it says that the state does conduct valuable research. You have the right to opt out of storing your child's blood forever.
just indicate that you are aware of these things. It's like a Miranda rights, essentially, for the program. There's no ban. There's no participation. There's nothing. This bill does not address that at all.
Okay. And I have to admit, I do have some concerns about, given the value of newborn screening, that we not discourage people inappropriately from getting their children newborn screening. Because the reason we have those newborn screens are these are conditions in which if you don't catch it early, by the time they're symptomatic, it's often too late or there could be permanent damage. So I just want to be sure we're hitting the right balance in terms of, obviously we want to protect people's privacy, but what really is the risk to privacy given the current system and against the possibility of harm for babies that from diseases if they're not screened.
And we do think giving moms 5 different pieces.
I'm sorry. I'm going to answer that first. I'm not sure if he wanted to ask that question to you, but I want to be very clear that this does not affect the initial screening at all. This is a form that is not even informed consent. It's just informed. The program, last year you had your bill on that. I was chair of appropriations. We worked very hard to get that bill out. We even went so far, as to argue with people who were wanted to pinch pennies, both in the assembly and also in the administration, that you really can't put a price on this type of screening. I think it is just one of the most valuable things that we do, and I was very happy to collaborate with you on that bill. The issue, though, of informing parents that the sample is stored, that's what we're trying to address. We're trying to address the issue of telling parents. I'm not aware of any, that's why I gave the example of a cholesterol test. I'm not aware of any other type of medical procedure where a sample is actually taken from somebody without their consent and then experimented on forever. I just think that's phase 2 and phase 3. It's separate from the initial screening. We don't want to affect the initial screening at all. We just want to inform people about phase 2, phase 3, which is the storage and the experimentation.
Okay, and maybe perhaps it sounds like
perhaps would the proponents like to follow up through the chair to answer the question to Senator Pan? The comment you were going to make earlier.
Yes, we share your concern that giving women 5 different pieces of paper about this one issue will make them overly concerned about newborn screening, which is actually a great process.
I believe Senator, I don't know who's first, so I think it's Senator Monning, Senator Roth, and then Senator Wolk.
So I just wanted to be clear on a couple of things. One, the identification of the dried blood spot, I'll ask first to the author, but then I think the opponent had a comment on this as well. My understanding is that the blood spot is not identified as the child's. There's a number that correlates it to the data bank, but anyone doing research on the blood spot doesn't have access to the child's name or the family name. Is that your understanding?
Well, although it's an imperfect analogy, that's like saying that a license plate is not tied to a human.
No, my question is the name on the blood spot in the bank where it's kept?
No, the card in the bank just has a serial number on it, but just like a car only has a license plate number on it, as long as there's a database that connects the two, it's not anonymous. Look, I'm chair of this new committee in the Assembly on privacy. I've been briefed from everybody from the FBI to our state IT people. Anything you put online is vulnerable. Anything you put online can be hacked. The idea that this is anonymous is laughable. It's as laughable as saying that if you get a license plate, you can't tell who owns the car. You have a serial number attached to the blood spot, yeah, but there's a database that links the names to the serial numbers. So, anytime you have something like that, it's subject to hacks.
Yeah, so I understand your explanation. Don't disagree, but if some researcher has access to the blood spot, or if somebody steals all the blood spots, they may have a serial number next to it, but they're not also getting access. They'd also have to hack some computer database simultaneously to the conversion of the blood spot to link it to an identity.
I'm not sure I understand the question, but I don't think researchers would be engaged in that. But I do think there is a danger to have, it's impossible for the legislature to predict the new technologies that exist. And, I think that it's very possible that at some point in the future, you would have somebody who breaches a database and puts all the information online. We've seen this happen this year with credit card numbers, with Anthem Blue Cross, with all sorts of different things. And, what I've learned is that it's not a matter of if, it's a matter of when.
Okay, again, we all up here would agree that databases are subject to breach. The question of whether serial numbers on a blood spot in a corresponding database can pose risk to that child or family, I'm not convinced. But check me on this. We have a handout of the newborn screening test that provides a parent currently, if you decide not to allow the GDSP to use your child's unidentified dried blood spot, you may request that the specimen not be used for research and or be destroyed by our laboratory. So that's currently available to parents. Is that correct? This ability to opt out.
So I had a daughter born in the last couple of years. This is a pamphlet that you're given. You're typically handed this. There's, you can't say with uniformity that there's a different point that every different hospital or whatever follows it. But you're given this during a very emotional time. You're not really thinking too much about, what's going on. And very few people actually read this materials, is what we've found. It is on page 13 of a 16-page bilingual pamphlet. And it's kind of like, if you're taking a shelf home from IKEA, you're given the bilingual instructions and trying to recall what's on page 13. That would be a bit much. Then you couple that with you're giving birth at that time and expecting the mother to really grasp that. It's different to give them a one-page piece of paper that they actually have to sign, and it's in plain English, and it says exactly what the program does. And that's what we're proposing. We'd be happy to make it a tear-out in the book. We'd be happy to go back to something more. But at the core of this bill is really, do you think people, whether they're babies, whether they're adults, should have their blood taken from them without their consent to be experimented on, no matter how safe it is? I mean, it really is like a core values bill, I think.
Right, so you're talking about making it more prominent. And so how about the concern that if there's a single form and the parent is asked to sign one way or the other, that doesn't run the risk of families not wanting the screening to happen?
Well, you can't opt out of the screening.
Yes.
But I think
there's three stages. There's screening, there's storage, and then there's experimentation. My bill has to do with stage 2 and stage 3, the storage and the experimentation. It does nothing to do with the screening. And if the idea is that people will get scared and confuse the three, I mean, I've never thought that if we inform the public of, say, the caloric content in products that they drink or things like that, I've always believed that the public that they will process the information, they will do good things with it.
Thank you. And then through the chair, I think it was the opposition who raised the concern of this potentially deterring parents from wanting their child to have the screening test.
There's a couple of things. First of all, researchers are not permitted to carry this information on a computer that's hooked up to the internet. So a hacker can't get in because it's not allowed to be on a computer that's hooked up to the internet. Yes, we are concerned about that. As I said, as we've mentioned, women already get 2 brochures. This bill would bring it to 4, and then the federal would bring it to 5. And I think there is a lot of avenue for confusion. And there is already confusion about if a mom asks for the opt-out form, the only opt-out form that's available is to opt out of screening the baby, not research. So there is a lot of opportunity for confusion.
So there is an existing opt-out form not to have...
To opt out of screening, that is correct.
That is parents a current parental right.
Parents can today opt out of screening, and CDPH has a form that hospitals are required to have.
For me, that's my biggest concern, is that a well-intentioned bill has the unintended consequence of families not benefiting from an early screening benefit, if their child could benefit from early intervention based on what's proven. I know others have questions, so thank you, Mr. Chair. I'll
Senator Roth,
stop there.
Senator Wolk, and then Senator Nguyen.
So I guess this is to the author. Is your concern that the blood sample is tied to identifying data, and if the sample were de-identified, if that's the word, would that alleviate your concern?
I'm concerned with a number of things with the program, and I think the Newsweek piece and the 4 editorials have articulated all different angles. One of them is simply that this is not something we should do. It's probably morally and ethically wrong for any government to take someone's blood and to run tests on it. I can't articulate that as freedom of religion. I can't articulate that as anything. I just think it's morally wrong to do that.
It's consensual, isn't it?
It's not. It's not consensual. It is the current form. You know, I heard something about a form to opt out of the screening. That's the first time I've heard that. The pamphlet doesn't mention opting out of the screening. My bill doesn't can talk about opting out of the screening. It's not consensual. It's presented as something that happens, right? And it's just something that's done. The current participation rate is 99.97%. And in the previous hearing, we were told that the only people who don't do this are people who do natural births in caves in Mendocino County or something, right? And so I'm not sure that there is much consent. What I'm trying to do is give parents that information about the storage and the experimentation.
Well, then I guess this goes to the opposition. Why do we keep identifying data? Why do we even have a serial number attached to a blood sample once the initial screening test is done? If the blood sample is going to be used for research next year or 5 years from now or 15 years from now?
Can I? Okay. Yes. If a parent, let's say there's a missing baby, or a baby comes down with a disease and they want to do some research on what the blood looked like when the baby was born, the physician or law enforcement, with the parent's permission, can go back to CDPH, and CDPH would look in their database, which is not online, find out the baby's serial number, and go get the baby's blood and give it to law enforcement or the physician.
But that's a whole other level of disclosure that may or may not be occurring, right? I mean, that's totally different than what we've been talking about.
This is in the brochure. Parents are told this in the brochure.
Okay. And then I guess my last question goes to this forum business, and maybe Senator Monning asked and received the answer to it, and I'm just too simple to understand it, but why can't we simplify this forum business and boil this information down to one document so people aren't getting 4 or 5?
That is certainly our goal. You know, I think I was kind of curious to hear that the federal government is going to do a 5th form or whatever. Most people who watch the federal government, they're going through a regulation process. Next year, they're going to mandate that any researcher who wants to do research on these blood spots have to have the informed consent that my bill would like to have in it. So it's, you know, next year before the legislature, there's a good chance that a lot of the research universities will come back to us and be begging us to pass this bill in an even stronger form. But I agree. I think that it should just be one form. If I had my druthers, we would have this in a way that was just really easy to understand so that people of all of California could have this information, because you know, ultimately it's their child's blood, it's not ours. And you know, you really talk about, you asked me about my other concerns. I mean, maybe, I guess I asked the question, does it bother anybody that a government entity has a DNA database of every child born? I mean, the civil libertarian concerns about that are profound. I mean, any of us who considers ourselves a civil libertarian should be tremendously concerned that we have, and that's what a lot of the editorials pointed out, is that it sounds so crazy. It's almost unbelievable that a government entity is storing people's genetic material. It's just bizarre.
So, Mr. Chair, may I have one other question? So something must require these other forms, 2, 3, or 4, however many there are. Is that some state law?
I'm not aware about all these other forms. As a matter of fact, you know, you've got this one brochure, which is the most common form, and that's the one we've talked about. Parents are given a lot of information when a child is born. I've gone through this twice in the last 5 years. we're trying to simplify it. That's what this bill does.
I guess the reason I ask that question is if there's a state law that requires these other 2 forms or these other 4 forms, then why wasn't that statute amended to add some particular language that you're trying to get at here?
This is not a state law. This pamphlet is put out by the California Department of Public Health. It's not based on a statute. Very good point. We would have amended that statute if it was. So to hear the CD, well, they're not here, but to hear talk like, well, we have to do all these forms. We don't mandate this form. This form is done by departmental fiat. And this statute would be the first time that we as a legislature say, here's your simple form. If they want to keep doing this, they can do it or they can't. But we don't mandate that.
I guess in your bill, you could have wrapped your arms around those other forms at the same time and combined them by statute, correct?
They fought us so hard in the first House that that was our initial plan. And
I understand that.
Yeah.
Thank you, Mr. Chair.